viewers. I am Dr. Omale Charles, an ophthalmic surgeon and the MD of Royal Eye Hospital, Life Camp, Abuja. You are welcome once again to one of the series in our presentation about eye problems and what we need to know, what we need to do per time in order to save our sight. Today, we'll be talking about cataract. Cataract is a very familiar term to most people. What does it really mean? It means opacity, or if you like, cloudiness in the natural crystalline lens which we all carry in our eyes. The lens is an instrument for focusing in the eye, next in power to the cornea, which is the black circle in front of the eye. So without the lens, there will be a significant loss of ability to focus on objects or to see anything clearly. So if the lens becomes cloudy or becomes opaque such that light cannot pass through to the retina, then we call that condition cataract. Now, how widespread is this condition? It may interest you to know that it is a global problem. It is responsible for almost 50% of total blindness worldwide. The leading cause of preventable blindness in the world is cataract. While on the other hand, remember in weeks ago, we talked about glaucoma. Glaucoma is the leading cause of irreversible blindness. So don't mix it up with cataract. I've met people who don't really know what difference exists between the two. These are completely different conditions. Cataract is number one leading cause of reversible blindness worldwide. Glaucoma, on the other hand, is the leading cause of irreversible blindness worldwide. It affects both male and female. There is no sex predilection. However, I will go on to talk briefly to us about what may cause cataract. The number one cause cataract everywhere in the world is advancing age. As people get older, the natural crystalline lens tend to become cloudy or opaque so that light can't travel into the eye for you to see clearly. It's usually a very slow process that progresses over time until such a time that vision is completely obscured and the person can no longer see. The second thing to look at is trauma. Trauma to the eye can be from road traffic accident, it can be from people engaging in physical scuffle, fighting, it could be children playing with sharp instruments that penetrate their eye in the process. It could be chemical related, it could be burns. All of these are trauma that can predispose to cataract apart from age. So younger people can have cataract as a result of trauma or what we regard as inflammatory processes within the eye. Some people will develop a condition we call uveitis, which may not be related to trauma, and one of the consequences is cataract formation. So that can happen at any age, but don't forget, the number one cause of cataract worldwide is advancing age or old age. Most people in their 70s and 80s already have some degree of cataract. Okay, so now, how does it present typically? When cataract occurs, vision becomes cloudy initially. Then it progresses over time. It doesn't cause pain. It doesn't cause you to lose your sleep. But activities of daily living will gradually be interfered with. until such a time that the person is unable to carry out most activities of daily living as he or she was doing before. At that point, we regard it as significant enough for intervention to take place in order to reverse the process or restore vision, as it were. And now, what treatment options may be available for cataract? Well, it will interest you to know that there are lots of information on the internet concerning certain medications that when you swallow them, the cataract dissolves or it disappears, as the case may be. These are not true from a scientific standpoint. Yes, science is an evolving discipline, but we have not gotten there yet where somebody will swallow medication or apply any particular medication and cataract goes away. It is a total deception. The only recognizable treatment option for cataract globally is surgery. And surgery can be broken down into different types. We have the manual type, we have the laser-based types, they're all available. And once the procedure is done correctly by the competent doctor, vision is restored in more than 95% of people, except if there are other problems within the eye that could affect quality of vision even after a successful cataract surgery. So it suffices to say that see your doctor if you think your vision is diminishing, becoming cloudy, you're unable to read well, you're unable to drive at night, you're unable to watch TV clearly, you're unable to read your books. See your doctor for a proper evaluation. It is important because a stitch in time saves nine. Cataract, when left untreated over time, can get complicated. And what you would expect of a visual outcome may spring a surprise at the end if complications have set in. Now, what do we do to prevent cataract, if there's anything? Well, it's not a condition that is preventable per se. Like I said earlier, age is the common denominator in people with cataract. So if there is a condition that is tied to age, there's hardly anything you can do to prevent it because people keep getting older. However, before you get old, there are steps you can take. In our environment, we are exposed to a lot of sunlight. So wear your sunshade, polarized or UV filtered sunshade preferably. Not just any sunshade you buy from the roadside because that could be counterproductive. They are not safe at all right? Then wear hard if you work outdoors, like a field worker, or you find yourself doing a lot of your daily activities in the sun, wear a hat so that you limit the ultraviolet radiation coming into your eye that can induce changes that may eventually lead to distortion in the lens protein and cataract formation. Okay, some people have a genetic predisposition. Sometimes you find people in their 50s or even 40s having cataract, and if you ask them, they will normally volunteer to you that members of their family, have always had such a condition at a relatively younger age. If you are from such a family, take steps to have your check done as early as you can. Avoid anything that is going to cause trauma to your eye. Everything that is under your control, please take advantage and ensure you don't have any form of trauma to your eye, especially that which involves fighting. Do not engage in fighting, whether privately or in the public. I've seen many losing their eyes in the process. I've seen many developing cataract because of trauma sustained during fighting. Avoid all of that. In your house, don't keep sharp instruments within the reach of children, especially things like toothpick or the elastic band that is used in tying money, um, needles, anything that is sharp. kitchen knives and what have you. Keep them out of the reach of children. You would have done a lot in preventing some complications that could arise later in the life of that child. Now, cataract, let me drop this line, is a global problem, like I said earlier, and the burden on the developing country is enormous. We are unable to meet what would have cleared the backlog of cataract we have in this part of the world. One is low manpower. Two, there is lack of political will on the side of the authorities. And then three, most of the hospitals around are poorly equipped, and even though there are hands that could handle these problems effectively, they are challenged. They are unable to do what they ought to do. The output you get from most centers are under what they are estimated to be able to do because of lack of adequate equipment. And so, from time to time, I personally get involved in reaching out to communities where they would have, had no access over the years to help out and see what can be done. If we have sponsors, yes, we engage in such to help clear the backlog that we still have in this country. I was surprised in some communities I traveled to find out some people were bedridden, for 10 years, for 15 years from cataract. And you can imagine what economic burden that will be on that family and how the younger ones attached to these victims would suffer. May not be able to go to school because they have to take care of the aged and the blind back home and all that. So the implications are enormous. And so this is another wake-up call to all interested individuals and organizations that are interested in bringing succor to those who are already blind from causes like cataract, so they can help. The government is already trying, in some centers, sponsoring free eye surgeries. Some NGOs are also into it. Be part of it. It is a call, to help humanity in whatever way we can. Cataract is 100% reversible. WHO has put it that it is one of the most rewarding surgical interventions worldwide. So let's take advantage of what we have around. See a competent doctor who is good at it. If you have cataract, you should have no fear at all. It's something that can be reversed by 100%. If you are diabetic, you should have your check as regularly as possible, because diabetes is a metabolic problem that can dovetail into cataract formation if it is not well controlled. Thank you once again for listening. If you have questions, please throw them around and let's have a discussion. And if you need to see a specialist to ascertain the status of your eye, feel free to contact us. We are here to help you. Have a blessed day.